Humans are Think back to that time and think about how much you've changed from that small child. What you have just done is practiced your self-awareness. Self-awareness is also how we know that we're separate from other people. Through self-awareness, we maintain a sense of self separate from others around us. It might seem to make us separate, but more than that, it allows us to communicate. Our awareness of ourselves is called consciousness. Consciousness is a concept that refers both to our self-perception and to our responses to the world around us. We think, we make choices, and consider our actions. We alter our behaviors based on what we know. We do not live our lives solely on instinct. We not only act, but we also reflect on our actions. What this means is when you're texting your friends, you're conscious that your message is being recorded, and you know how you express your opinions. Knowing your personal point of view and being mindful of how you communicate your beliefs to others is self-awareness. It's through consciousness that we choose to act, instead of just acting on the stimuli around us. Without consciousness, there would be no culture, no language, and most importantly, no reality TV. Since consciousness is fundamental to the experience of being human, psychologists have studied it from several different angles. For example, Freud focused on the power of the unconscious mind to influence our conscious behaviors. According to Freud, a central conflict in your mind is the one between your repressed unconscious desires and your controlled conscious behaviors. Of course, most people don't do everything that pops into their heads. Freud's theory makes this struggle the fundamental one of consciousness. Modern-day psychologists study conscious, deliberate behaviors like texting your friend to go to the movies, and unconscious, automatic behaviors, like your unconscious anxiety about whether your friend likes you. Psychologists also consider the role of dreams and drugs in altering consciousness. It might seem obvious or even trivial, but some psychologists follow in the footsteps of Freud and try to understand how we can use these altered states to understand the conscious and unconscious mind. Humanistic psychologists focus particular attention on our sense of self-awareness. Altered states of consciousness can be reached through sleeping, dreaming, being hypnotized, meditating, and taking psychoactive drugs. You may text your friends when you're sleepy or after you've had a few drinks. When you see the text message the next day, you may be surprised at what you texted while you were less conscious. Remember back when you were a child to the sheer thrill of spinning in circles until you were dizzy? This might have been your first venture into altered states of consciousness. The way you saw the world was changed, and that change was exciting. Altered states of consciousness sound exciting and maybe a little exotic, but we enter these states every day, whether from road hypnosis on the commute to work, daydreaming on our coffee break, or when we finally lie down to sleep. To review, humans are self-aware and possess consciousness. Modern-day psychologists study conscious, deliberate behaviors and unconscious, automatic behaviors. They also study altered states of consciousness, and some psychologists, like Freud, argue that these states are the bridges between the conscious and the unconscious. Average time spent sleeping changes over your lifetime. As a newborn, you might have slept 18 hours a day, whereas as an adult, you may sleep about 8 hours a night. As you get older, you may only sleep for 6 hours at a stretch. But what is sleep? And what goes on in your body when you're asleep? Your sleep-wake cycle is a biological rhythm, or a regularly recurring pattern. More specifically, it's a 24-hour cycle or circadian rhythm that's linked to daylight and darkness. Your circadian clock sets your internal functions like changes in blood pressure, body temperature, and metabolism to the local time in predictable ways. For example, you may feel more and more awake as the morning progresses, but then feel less alert as the afternoon wears on, then continue to slow down in the evening as you prepare for sleep. If you've ever traveled to a different time zone, you know the effects that jet lag can have on your biological clock. When you sleep, your body goes through 5 stages. During the first 5-minute stage, you transition from wakefulness to sleep. If you had electrodes on your forehead hooked up to an EEG, this machine could measure electrical activity in your brain. As you fall asleep, an EEG would show that your electrical brain waves change from rapid beta waves when you're awake to slower alpha waves as you become drowsy, and then finally to even longer theta waves as you drift off to sleep. During stage 1 sleep, you might twitch or feel like you're falling as you begin to drop off to sleep. The next 20-minute stage is a deeper sleep. Your heart rate and breathing slow. Your body temperature drops. Whereas stage 1 may feel like dozing off, if you were awakened from stage 2 sleep, you'd actually feel like you'd been asleep. Stage 2 is characterized by sleep spindles, or short bursts of brain activity. The third and fourth stages combined consist of 30 minutes of deep sleep, when your brain produces super slow delta waves. The difference between the two stages is the increased amount of delta waves in stage 4. During this stage of slow wave sleep, your pituitary gland releases growth hormones, and your muscles relax, and your body rejuvenates. After stage 4, the cycle repeats itself in reverse order, from stage 4 to stage 3 to stage 2. And after about 90 minutes of sleep, you enter REM sleep. When REM, or rapid eye movement, happens, your closed eyes move back and forth, and you dream. Your breathing and your heart rate increase, although on the outside you appear calm and asleep. After the REM stage, you return to stage 2 sleep, and the cycle continues. And you may complete up to 6 90-minute sleep cycles in one night. The length of your REM sleep tends to increase from 10 to 20 minutes as the night progresses. Thus, dreaming tends to get more intense as the night approaches morning. Sleep disorders can disrupt your sleep cycle, but many sleep disorders have biological causes, but some have psychological causes. For example, insomnia, or the inability to fall asleep, can be brought on by emotional stress. So you've learned about the 5 stages of normal sleep, which are linked to your daily circadian rhythm. And when you sleep, your brain waves get longer and slower at first, but short bursts of brain activity called sleep spindles happen in stage 2 sleep. Your body rejuvenates during the deep sleep of stages 3 and 4, and you do most of your dreaming during REM sleep. Sweet dreams.
I recently moved to a new city. Here, I live very close to the highway. While the noise pollution is minimal, I come from a far quieter part of the country where there is no noise pollution. So for me, that minimal increase in noise is significant enough to keep me awake. So much so that I've had to use earplugs to help me fall and stay asleep. Maybe one day I'll get used to the noise, but for now, that's what I have to do. Noise pollution is just one factor that influences rest and sleep. A hospital patient's stay, and for this lesson's sake, rest and sleep, are influenced by a myriad of factors as well. This lesson will point them out for you. Let's face it, our lifestyle influences the amount and quality of sleep we get all of the time. Those of us who smoke, consume alcohol, or are quite big on caffeinated drinks are going to suffer the consequences of getting little sleep or poor quality sleep as a result. If you exercise in the morning or day, congratulations! Not only are you keeping healthy, but you are actually going to enjoy better sleep, all else held equal, than people who do not exercise. However, if you exercise within 1 to 2 hours of bedtime, then you should remember this will hinder your sleep. We also have to factor in where someone works. People who work during the night have trouble getting enough sleep during the day. And even people who work during the day can have poor quality sleep at night as a result of the stresses encountered in their work environment. Stress can also occur from problems with family or friends, like arguments or financial troubles, which can ruin a person's sleep. While we can all choose to exercise earlier and to forego the $10 morning Starbucks latte, some factors may be outside of our control. These include some environmental factors and health concerns. If there's a lot of noise pollution, then obviously, like myself, a person is going to have trouble sleeping. If you live in a home that doesn't have air conditioning and it's a hot summer night, that's going to be a hard environment to sleep in. People who suffer from intractable, meaning resistant to treatment, unmanageable pain, will obviously have a hard time sleeping or getting quality sleep. Itching, difficulty breathing, fever, the need to urinate a lot, and plenty of other medical problems can keep a person awake as well. In a hospital setting, the promotion of sleep is a critical nursing function. Remember, it is during sleep that the body restores itself the most. Thus, the promotion of sleep itself, as well as high-quality sleep, is a very important aspect of patient care. So, what can you do to help a patient sleep? First, do all you can to ensure the environment is just right. Ask the patient what their room temperature preference is. I know for a fact I can't sleep well when it's above 68 degrees Fahrenheit. For many people, that's way too cold, but for me, anything above that is too hot. Given that, I also like to snuggle up in many blankets at night, and so give the patient as many blankets or pillows as they like. While some people like to sleep in complete darkness, a small night light may help in some cases since patients may not know their way around a hospital room. Safety is just as important as sleep. And given that, ensure that pathways from the bed to the bathroom and from the bed to the door are clear of any obstacles. This is doubly true if the patient is elderly or has trouble walking or maintaining balance. Finally, don't forget to close the door to minimize noise pollution. I know, given my introductory example, I'd appreciate it. Keeping the environment conducive to sleep is important, but so is patient comfort and relaxation, which often go hand in hand. You can help wash a patient's face and hands, brush their teeth, detangle their hair, and offer a snack and warm milk if they like. Some patients will need to be assisted with toileting and repositioning in bed to keep comfortable. Back massages can greatly help a patient relax. So can soft and relaxing music. Of course, for some people, the music will be a distraction, so meditation in a quiet environment may help them relax more. Another great way to help a patient feel comfortable and relaxed is to simply ask them questions about how they are feeling. Ask them if they feel worried about anything or if they are in pain. Sometimes just listening can help a person begin to relax. Literally, just listening and nothing more can help some people chill out after they vent a little bit. If a patient complains of pain, of course, then pain medication needs to be administered as necessary to help a person sleep soundly. One critical thing to note, as I'm a stickler for pain relief, is that if a patient complains of or is clearly giving off signs of pain, then treat the pain. Just because a patient falls asleep despite their complaints of pain, that doesn't mean they aren't in pain. Treat the pain. They may have a torrid night tossing and turning and getting bits and pieces of sleep if they don't get the pain relief they need. And in some cases, some patients will be unable to fall asleep in a hospital setting no matter what. In these instances, sleep medication may be prescribed by a physician on an as-needed basis. This lesson provided just some examples of the factors that influence rest and sleep, and there are many more. And there are many other things you'll learn to perform to help a patient get and maintain quality restorative sleep. Remember, sleep is influenced by environmental, physiological, and emotional factors. Things like caffeine, exercise, medical conditions, and stress can all influence the quality and duration of a person's sleep. You can also help a person sleep by listening to their needs, asking questions, assisting in their daily functions if they need help, and maintaining a comfortable and sound environment. And don't forget, if a patient is suffering from or complaining of intractable, that is to say, resistant to treatment or unmanageable pain or any pain, always treat the pain.
Sit in a comfortable position. Close your eyes. Breathe in, breathe out. Soften your jaw. Relax your shoulders. Let all your tension and worries wash away. Noise and concentrate your thoughts as by repeating a mantra or phrase. You can reach an altered state of consciousness through meditation and relaxation techniques. When you focus your attention and increase awareness of your own physical and mental processes, it's possible to ignore the distractions of the outside world. Meditation has been shown to have positive effects on its practitioners, including reduced stress levels and improved physical and mental health. Meditation leads to increased alpha and theta brainwaves, which are linked to relaxed states of mind. Close your eyes. Slowly open them. Close your eyes again. Notice how good it feels to rest. Slowly open them. Close them again. Your eyelids feel heavy. Slowly open them. Close them again. Each time you open them, your eyelids feel heavier and heavier. You're getting very sleepy. If you're open to the power of suggestion, you may be more easily put in an altered state through hypnosis than someone who's less susceptible to conformity, obedience, and suggestion. Under hypnosis, your perception and actions are influenced by the hypnotist's suggestions. Freud hypnotized his patients in an attempt to bring their unconscious desires to the surface. Hypnotherapy is sometimes used to treat phobias, drug addictions, and overeating. It can even be used as an anesthetic if a hypnotist convinces the patient that they don't feel any pain. Suggestion is the key concept for hypnosis, but hypnotists differ in how they believe the suggestions are processed. American psychiatrist Milton Erickson believed that hypnotists communicate with the unconscious mind, so he made suggestions that were indirect or metaphoric. Instead of commanding patients to stop smoking, Erickson would invite them to change by encouraging them that they could become non-smokers. Psychologists Theodore Barber and Nicholas Spanos promoted more direct suggestions because they believed they were communicating with the conscious mind, and that someone who was hypnotized was actually following suggestions because they were expected to. Both meditation and hypnosis can lead to an altered state of consciousness. A relaxed and focused state can be achieved without drugs through guidance or suggestion. Hypnosis is often used to stop unhealthy behaviors, and meditation is used to increase awareness by focusing attention.
Psychoactive drugs have these effects because they impact neurotransmitter function. Neurotransmitters are the chemical signals that affect how hungry, thirsty, anxious, scared, happy, or tired you are. There are 4 main types of psychoactive drugs: stimulants, depressants, narcotics, and hallucinogens. Stimulants range from nicotine and caffeine to cocaine and crystal meth. Stimulants block the reuptake or reabsorption of neurotransmitters like serotonin and dopamine, which can lead to increased energy, panic, and anxiety. Think about how coffee or cigarettes can make you jittery. On the other hand, depressants increase the production of the neurotransmitter GABA, which decreases reactions in the brain. Depressants like alcohol cause slowed reactions, impaired speech, and drowsiness. Depressants affect cognition by impairing memory. Depressants like benzodiazepines help GABA neurotransmitters bind to receptors that receive the chemical signals, leading to reduced nervous system activity and inducing sleep. A third type of psychoactive drugs includes narcotics, like morphine, heroin, and codeine. Narcotics may be administered as painkillers for medical reasons or used recreationally to create a sense of euphoria. They stimulate your endorphins, which are neurotransmitters that naturally reduce pain. Hallucinogens include LSD, mescaline, and ecstasy. These drugs mimic the effects of neurotransmitters serotonin and epinephrine, which lessen pain. They can also trick the brain into seeing or hearing things that aren't actually there, warping a person's sense of time and space. These altered states of consciousness can lead to paranoia and anxiety. Some researchers put cannabis in a 5th category, since marijuana and hashish have effects similar to both narcotics and hallucinogens. Your nervous system will try to rebalance when your neurotransmitter levels are increased or decreased in the presence of psychoactive drugs. You could become drug tolerant if your receptors are overstimulated from prolonged drug use, resulting in fewer or less sensitive receptors. Tolerance can lead to addiction or system dependence, since more and more of a drug is needed to achieve the original effect in a less sensitive system. Long-term drug use affects the body, so some drugs produce withdrawal symptoms when you quit. Not all drugs are physically addictive, though many are psychologically addictive. The prevailing theory on marijuana seems to be that it's more psychologically addictive than physically addictive. And people become physically addicted when they're trying to avoid withdrawal symptoms. Withdrawal is no joke, and you can actually die from the withdrawal symptoms of some drugs, which is why severe addicts must be monitored and sometimes given low doses of a drug or a substitute drug to counteract the negative effects. Heroin addicts may be given the synthetic drug methadone to wean them off heroin, which is a more potent narcotic. Drugs have different effects on different people, and they can even have different effects on the same person under different circumstances. Some things that affect reaction are the amount and potency of the drug. Do you drink 1 cup of espresso every morning or an entire pot of coffee? Your mood and motivation can also be factors. Compare the effects of a celebratory glass of champagne to toast your friend's marriage or a stiff drink after a stressful day at work. Your expectations can influence the effects too. Are you drinking because you're trying to unwind, or are you looking to party? Is the drug being used as a medication or for recreational purposes? How a drug is administered has an influence. If you smoke a cigarette, the nicotine enters your body through your lungs, whereas if you wear a nicotine patch, the drug enters your bloodstream through your skin. Your tolerance is also affected by your prior experience, age, and weight. And even the environment in which a drug is used can affect the outcome. To review, psychoactive drugs
alter your psychological state by affecting your neurotransmitters. Psychoactive drugs range from coffee and sleeping pills to heroin and cocaine. Each has a different effect on cognition depending not only on the potency of the drug, but also on factors like mood, expectation, and the environment in which they're taken.